In Uganda, the prevalency of self-reported STIs has remained persistently high, with an increase from 22% in 2006 to 27% in 2011, while you look up to 1.5 million cases of STIs being reported between 2015 and 2017. Female adolescents and young women have the highest risk of curable STIs, and in Uganda, the time trends and correlates of STIs among adolescent girls and young women between the ages of 15 to 24 years. Now, this high prevalency of STIs and associated adverse health outcomes makes STI control a public health priority. It's against this background that the Ministry of Health, in partnership with the Uganda Network on Law Ethics and HIV, UGANET, and the AIDS Support Organization, TALKSHOW, with support from the Global Fund, bring you this dialogue this Wednesday, the 20th of July 2022, at exactly this time, live on NTV. A warm welcome once again. My name is Priscilla Regina Naluoga, your moderator for UGANET's topical dialogue that is aligned with HIV, AIDS and STIs in partnership with the Ministry of Health. And my panelist, Dr. Peter Chambade, is a Senior Programs Officer, STI and Key Populations, SCP, under the Ministry of Health. And he's here to address these issues and also channel for us the way forward. Good morning to you, Mr. Peter Chambade.
Good morning.
How are you?
I'm fine.
Okay,
yes.
So let's get right into the nitty-gritty of it. Sexually transmitted diseases, they have been generally neglected and ignored when it comes to the campaigns around them, the fight against them. So let's first start from the basics. What are STIs in the first place?
STIs, it is an acronym for sexually transmitted infections. Sometimes we use STD, which is sexually transmitted diseases. The infection differs from a bit diseases because you could have an infection, but you don't have signs and symptoms. Then you refer to it as an STI. But when you start developing signs and symptoms, we say you have a disease, then it becomes sexually transmitted disease. As the word goes, sexually transmitted, they are basically transmitted through sex. Unprotected sex specifically. If you have sex with somebody who is already infected and that sex is not protected, then you end up with a sexually transmitted disease. Yes, basically that's what sexually transmitted diseases are.
Okay, and what are the most commonly transmitted diseases sexually that we account for here in Uganda?
Globally, I would say sexually transmitted diseases are very common. Globally, we get about 350 million new infections every year of the curable STIs. Some STIs can be cured, others cannot be cured. But if you just look at those that can be cured, you are looking at almost 1 million infections happening every year. And the picture does not differ from country to country in terms of the way these diseases present. They commonly present with the signs and symptoms within the private parts. But what is important to note is that majority of the people that are infected with STIs actually do not have any signs and symptoms. And because these people do not have any signs and symptoms, and it's not our culture commonly in many, more so in the sub-Saharan Africa, to seek for medical care when you are not sick. Majority of the people never seek for care. We never go for medical checkups. And therefore, they continue transmitting infections, STIs, unknowingly. It's just a few of those that develop signs and symptoms that come to facilities, either private or government facilities, public facilities. And the major presentation is that they present with the sores in the private parts, which we call genital ulcers. Some of them present with the discharges in the private parts. For men, it is called a urethral discharge, and for women, it is an abnormal vaginal discharge. And of course, they also present sometimes with the growth within those private parts. Things can come up and grow within those private parts. But usually, sometimes, particularly in women, when they come a little late, they'll be presenting with low abdominal pain because the infection has already moved up into the tubes. And when it goes up, then they're just going to be presenting with a lower abdominal pain. But the presentations are quite varied, because commonly many present when it is already, it's beyond, not within the acute phase, but in later phases when they already have complications. Some of them, of course, present with ectopic pregnancies, like in women. The most significant proportion of those that present with ectopic pregnancies, that the pregnancy has gone into the tubes, it's just because of the previous STIs. Others present with infertility. Of course, what is seen is infertility, and what is seen is an ectopic pregnancy, but the underlying cause is actually an STI. Others present with abortions, like in syphilis. Syphilis is a significant cause of abortions in women, and of course those will be present. So what will you see is an abortion, but the real cause actually is an STI. They also present with cancers, for example, cervical cancer. So the presentation is quite varied. Cervical cancer, but the cause actually is a previous STI, which is a virus called the human papillomavirus. You can also present with a liver problem. Hepatitis B. Hepatitis B is also a sexually transmitted disease, majorly. And you will be presenting with liver problems, sometimes with what we call liver cancer, and others called liver cirrhosis. But all those, it's just because of the previous STIs. In the children, when they are born, so it's quite a range. In children, they can present with eye problems, because during birth, the STIs, if a mother is infected, the eyes of the baby can get infected, and therefore present with either later in life sometimes, with even blindness. So the presentation is quite varied depending at what time you present. If you present early, you get the early signs and symptoms, but if you present late, you are just going to be presenting with the complications.
Okay.
Yes.
Dr. Tambade, we also want to find out from you, automatically it should be sexually transmitted, exactly. But I know that there's various ways that these STDs are actually spread. Could you enlighten us on those various ways?
Of course, for STIs, the major transmission is sex. But that doesn't mean you cannot get these diseases through other modes of transmission. For example, if you get transfused, if somebody, for example, has, let me say, hepatitis B, if somebody, HIV, by way, basically, it's also an STI, sexually transmitted infection. So you can still, syphilis itself is, so quite a whole range of these STIs. If you get, for example, transfused or get any body tissues from somebody who is already infected, and those samples or tissues or blood was not screened, you can still get infected through that mode of transmission. But you can also get infections through sharps. For example, you can get hepatitis B through sharps, if like needles and syringes, and any sharps, if these sharps have been in contact with somebody who had already an STI, and you also use the same, you can actually become infected. So the major mode of transmission is through sex, but you can also get it through, of course, blood transfusions and other body tissues. But you can also get it from mother-to-child transmission. If a mother is infected with an STI, similarly, they can transmit STIs to their babies. The usual common contact without really sex, it's not really transmissible. Although sometimes people claim that, I sat on a toilet, whatever, and then, but that's not. That's
minimal.
It is sex. It is just trying to cover up for.
All right. So when you say sex,
yes.
Someone
unprotected sex. Basically.
Okay, because that's what I needed to clarify on, because there's
yes.
protected sex and there's unprotected
sex. Of course, if it is protected sex with a condom, there is already protection through the condom, and that's why one of the major key tools in the prevention of transmission of STIs is basically the condom.
Okay, let's talk about the reasons as to why we're having sexually transmitted infections and diseases on a rise. The prevalency rate is actually persistently high. It doesn't seem to be coming down. And the recent data collected doesn't make things any easier. Because of COVID-19, people were at home, so there was a lot of sexual engagements. There was a lot of adolescents that were used because of sex. There were so many young children, young girls that were married off at tender ages, and so they end up in a place whereby they are not safe to have sex. They're not protected from that kind of environment. We had so many young girls actually getting impregnated, which then comes also with the issues of STI and STDs. And so the prevalency rate seems to be still high. And what could be some of these underlying causes and reasons?
Yeah, the reasons are quite many why STIs are common. Of course, they are common because sex is also very common, and they are sexually transmitted. So by the mere fact that sex is common, and these are sexually transmitted, and the commonly unprotected sex. Because if you look at the surveys that have been over years, we have been having a reduction in the condom use, more so in the younger people, the youth. The condom use is going down year by year. And therefore people are having sex, but it is unprotected. That alone is a huge, huge factor in the increase in the numbers that we see. But of course, there are quite a number of factors that are responsible for the transmission, particularly ourselves in the sub-Saharan Africa. One of them is the younger age group. If you look at our population, the younger people, the adolescent girls and the adolescent women, I mean the younger women, the adolescent boys, and of course sex is natural. At a certain age, the urge just comes. So because that urge is natural, when they reach that age, the adolescent age, the urge for sex automatically will come. And because majority of our population is young, we're therefore likely to see the larger the population, because as the population grows bigger, you are like, and it is the younger population, you are likely to see more STIs. But also the issue of course, information. The information is not widely available because if you look at our cultures the way we are brought up, sex is kind of a taboo. Not so many parents can talk to their children about sex. And if you cannot talk to your children about sex, somebody else is going to talk to them. And of course, they'll never tell them everything else because the major source of information is basically their peers, their own, who also do not have information. Therefore, nobody even ever gives them information about how they can protect themselves against STIs. And therefore, the culture also now comes in because it's not a common culture for us to talk to our children about STIs. It's quite a big, big problem. And of course, with the advent of also HIV, when HIV came in, because it came in as an extremely terrible disease, all efforts, I would say, across board focused on HIV. Yes, I mean on HIV. HIV, yes, it is an STI, but there are many, many other STIs beyond HIV. And because most of the focus shifted from STIs to HIV, because of course, the impact of HIV on the society, there was a tendency to kind of forget, but this did not happen only in Uganda alone, it happened globally. Even the funding for STIs globally, even in the country, everywhere, it kind of reduced, and the focus was major on what? On HIV. Which of course, it's not because the STIs had gone away, but just because STIs HIV presented in a much more severe way, and therefore there was that, which was of course a gap. But also STIs are quite many, it's a whole range. It's not like one disease, HIV, which I did, it is, there are quite so many. And that also creates a problem in terms of putting up interventions, because you need to put up interventions for so many of these diseases in terms of treatment, for example, But remember, I also told you at the beginning that many people that have STIs do not have any signs and symptoms. And because they don't have any signs and symptoms, they continue having sex and transmitting. But also, if you look if you look at treatment itself, looking at the treatment of STIs and the other diseases, the cost of treatment is extremely high for STI. STI drugs are very, very expensive. Therefore, even if people, even if the public system was not able to completely provide for them, going to the private facilities is quite expensive and many people cannot afford. So it is a whole range of issues why these STIs are common. And of course, coming in the COVID issues, people were not able to, could not easily access facilities. But also, once people are redundant, they're doing nothing, the common thing that people will be resorting to what? To sex. So it is quite a complex situation, and it wouldn't be surprising if we are seeing more STIs now.
Okay.
Yeah.
Dr. Chambade, you have brought in the argument of HIV and how all attention has been geared towards more of HIV and AIDS than STIs.
Yes.
Now, there's good evidence that indicates that if we play a part in actually the control of STI and STDs, perhaps then there will be management in the HIV transmission rate, especially in developing countries like Uganda. Is this statistically true, and if so, what is the case for Uganda currently? Yes,
of course, STIs in a way also promote the transmission of HIV, because naturally the private parts or our private organs, naturally they have a lining that is a barrier to HIV. That's why you find that not every time, sometimes when people engage with people who are infected with HIV, they actually get HIV. That's why we have a very high rate of discordancy. You find two people, husband and wife, not having protected sex, but one is HIV positive and the other is HIV negative. Because naturally, the linings is a barrier to transmission of HIV. But when you get an STI, which breaks that barrier, by weakening it, for example, getting an ulcer in your private part, or you getting any ulceration there, then the chances of getting, of course, HIV become higher. And therefore, management of STIs and prevention of STIs prevents also transmission of what? HIV. But also whatever, because STIs, I mean HIV is majorly sexually transmitted, whatever prevention measures that apply to HIV can also apply to STIs. But of course, the challenge is that STIs in themselves do promote transmission of HIV, and therefore it becomes very, very important that we prevent STIs and we manage STIs appropriately to stop that transmission that would arise as a result of HIV. I mean, as a result of STIs.
Okay.
Yes.
All right. Thank you so much, Dr. Peter Chambade. We're going to be taking a short breather, but when we return, we want to look at apertures that the Ministry of Health is adopting into post-COVID-19 and, of course, under the midst of the economic crisis that we're having right now, and the impact of these STI and STDs on the economic burden of a developing country such as Uganda. Stay with us. 30 minutes to the top of the hour. Midday, we continue having the conversation on HIV, AIDS and STDs in Uganda. And we're having this conversation with a person from the Ministry of Health in partnership with UGANET. My name is Priscilla Regina Naloga, and Dr. Peter Chambade here joins me. Of course, for the last half of the hour, he's been giving us a brief about STIs and STDs and the prevalency rate in Uganda and where we stand right now. One of the key things that he's talked about is the cost of treatment and how it's very high for STDs and STIs. Then he has also talked about the cultural change and cultural approach to having the conversation on sex, right from the family setting or household setting onto the national level, upon which we want to pick up this other half of the hour, looking at the apertures that are being adopted by the Ministry of Health and its partners in regards to the fight against STDs and STIs. Now, the reality reality of the matter is that these diseases are more or less epidemics, Doctor, and they kind of have a huge impact on the health and the economy of any country, especially in Uganda. You brought about a figure globally, the 340 million new cases of STIs that are registered on an annual basis, and yet you get to look at 17% of those contributing to economic loss in just one developing country. Case in point here is Uganda. So what are those apertures that you're looking at to control sexually transmitted infections and diseases?
Thank you. The control of sexually transmitted diseases relies on basically 3 pillars. The first pillar is that of prevention. And the prevention, for those that are not infected, we are starting with those situations where somebody is not infected. It's behavioral change, giving information to people to know how they can get STIs, so that by giving them information, they are able to protect themselves against STIs. And therefore, providing information through all ways, all mechanisms, all channels, could be TVs, could be radios, the way we are here on TVs, it could be even social media, just providing information to people to understand. And basically that's what the ministry is now doing. It has programs on TVs, on radios, but also on social media, working of course with the civil society organizations to ensure that people have information as far as STIs, to get to understand, first of all, how STIs are transmitted, but also to be able to know the signs and symptoms of STIs so that they can recognize STI signs and symptoms early and possibly seek medical care. So the first thing basically is through health education, giving people information, engaging the gatekeepers, engaging those that actually can provide information to all people. And of course our adolescents, because it's the younger people that are most affected by the STIs. Therefore, information is the key to prevention of STIs. And of course, we cannot assume that because people have information, the younger people have information alone will stop them from having sex. Therefore, giving information, age-appropriate information, particularly those that are within the sexual active age group, giving them information about the condom is very key. Because you cannot assume that these younger people are not going to have sex. But if they were to have sex, can they have it protected safely? Of course, the best thing and the first thing is to avoid sex. Abstain. But we know that it's not something that people can hold on. And many times our adolescents and our younger people fail to abstain. But if they went to that level of having sex, can they have it in a way that does not put them at risk? And therefore, giving information about the condom is very key. Therefore, condom remains a key tool for us in terms of prevention, apart from information, but also giving information about the condom, but also making the condoms available, both in public facilities and in the communities, but also in private facilities like pharmacies, so that people can easily go and buy a condom. Subsidized sometimes, some of these condoms are already subsidized. So government does subsidize some of these condoms so that people can get them cheaply if they cannot go to facilities where they can get them freely. So that is very key, prevention. The second, that even if you do prevention, of course, still people get infected. And therefore, once people get infected, the only tool now that you have is to treat them, manage them, treat. When you treat people of their STIs, you are able to break the transmission chain. Because people will not stop sex, even if they have STIs. So the best is treat them, cure them, so that you break that transmission chain. So that's basically the second pillar that we use, providing treatment for STIs in facilities. In
regards to treatments, there's this whole stigma around STIs and STDs. When you go to the hospital, just even taking an HIV test, the treatment that you get from the lab attendants or the nurses, oh, did you misbehave? You know, and so the approach alone, when someone is maybe suspecting that they're having a sexually transmitted infection or disease, then the approach they get from the medical personnel is not helping. And so it pushes people further away. They would rather find themselves in a place of self-medicating, assuming things that they don't have or they do have, or maybe just making over-counter consultations just to step away from the shame that comes with STIs and STDs in society. What are the remedies that you are doing as the Ministry of Health in regards to fighting the stigma?
The stigma, of course, stigma for STIs, it is true, it is there. It is arises or stems from partly our culture when it comes to sex. When issues of, first of all, as I said before, issues of sex are never talked about. And sex, having sex alone, is something that people look at as if it is more immoral, let me say. Not until you are you are, let me say, in married officially or in a relationship, a stable, let me say, understandable relationship. Any other sex outside that, of course, it is the way people view it results into stigma. So when you present to facilities, the healthcare providers, of course, they are part of the society, they are part of our community. That one is still affects them. But what we do as ministry that we do train. We train and we sensitize our healthcare providers. We do train our healthcare providers, and one of the key components in that training is stigma reduction, minimizing stigma. So we do that, but of course, human beings are human beings, and still I do accept that still we do have that stigma, but we just need to continue, of course, educating our healthcare providers, and of course make them understand the dangers of stigma, but still the impact of culture as far as sex is concerned sometimes comes out, and sometimes people are not received well. It does happen, but we just have to continue with that. Otherwise people end up going for self-medication, which will not be of value to them.
Okay, then this begs the question in regards to the information is available, the solutions are available, but then it brings into question individual, community, and also targeted intervention strategies or structural approaches. Here in Uganda, we have looked at village health teams, district health officers, all the way up to national. In COVID-19, we seemed to have seen the village health teams actually aiding a lot in the fight and the treatment of COVID-19. Now, when it comes to STIs and STDs and HIV and AIDS, how do we actually use this very same structure to bring about the message of prevention better than cure?
Yes, the message of prevention ideally should be delivered at all levels. And of course, as a country, we do have all those structures right from the community. And the way the minister does it, not just focusing at, these are other STIs alone, but also including HIV, is ensuring that, for example, the village health teams, including other structures within the society, the communities, particularly in the communities that are most burdened by STIs, like the sex workers, the adolescents, the use of peers, their own peers, to give them information, to be able to communicate their communities about the STIs. So we do use those peers in those different communities that are most affected by STIs. And the government, of course, has quite a number of programs targeting those populations that are most affected by STIs, the key populations, but also the adolescents. We have peer programs working with the civil society organizations where they go to their communities and educate their own about STIs. More so recognition of signs and symptoms, but also the prevention. They also actually participate in the distribution of these commodities like the condoms within their own communities to ensure that there is easier access to the products that can help them prevent STIs. So the structures are there, but also at a higher level, we, as I said, in health facilities, if somebody at the end got infected, the provision, ensuring that healthcare providers are trained, but also provision of STI drugs within those facilities is part of the program to ensure that we break that transmission chain. And of course, at national level, the national level provides the policies, the guidelines, the guidance to how we should be managing the STIs and how we should be preventing STIs. Yes.
Dr. Chambade, in the communities that we're speaking of today, we do have different vulnerable categories, or in medicine, what are known as high-risk groups. One of them is women, especially adolescent women. Now, you get to look at particular areas that you have talked about, hotspots for STIs and STDs. Adolescent women tend to be at a higher risk of getting these diseases. There's also the ignorance of appropriate methods that they can use, or even preventative measures. Then there's also the cultural setting whereby they are forced into early marriages, where they have to have sex or intercourse for that matter, and it's very difficult or impractical to negotiate safer sex. There's rape cases from the police report 2020 into 2021 was very high. It doesn't go any lower in 2021, 2022. So it looks like there's more need for female controlled methods of protection, and they're badly needed at such a time as this. So from the Ministry of Health, what are you doing towards the protection of women against STIs and STDs right now as a high-risk group?
Basically, as you said, majorly focusing on our the adolescent girls and young women. It is very true. They are very prone. They are quite, the risk to STIs is quite high. But of course, as I say, that the key pillar in terms of prevention of STIs is providing people with information. They need to understand that STIs exist. They need to understand that STIs are common, and they need to understand that in case they engage in unprotected sex, they are actually going to get infected with the STIs, and after, of course, getting infected, there is a whole range of complications that they are going to suffer. So the first tool is information to the young people, the adolescent women and adolescent girls and our young women. Not just, of course, focusing on the women alone, but also focusing on the males, because, of course, the major, of course, sex is between the two. Therefore, giving the same information to the male partners, how STIs are transmitted and how they can protect. And of course, apart from information, you cannot just rely on information alone. There are tools that can help us prevent STIs. And as I said, the key tool in terms of prevention of STIs is a condom. A condom remains the major tool in the prevention of STIs. And that's why I said that condoms are being provided by government free of charge across communities, everyone in these communities. But also there are other mechanisms. For example, if you look at our facilities, we have programs in those facilities that screen for STIs. I say that most of the people that are infected with STIs do not have any signs and symptoms. But that does not mean that they cannot transmit. They do not have any signs and symptoms, but they continue transmitting. And therefore, the best that you are able to prevent that transmission from people that are infected but not have any signs and symptoms, therefore they're not seeking any medical care, the best is to screen them for STIs. And we have quite a number of programs in facilities that do that. We screen, for example, if you look at our pregnant women, we routinely screen them for HIV. HIV, remember I said it is an STI also, but also screening for syphilis, it's a routine screening. Hepatitis B, we screen routinely, all those. So all those screening programs that are within our facilities, some of these programs, of course, go deep into the communities, screening for HIV and all these other stuff. Within the communities, they're also there. And of course, as the technology improves, medical technologies become available. We have other things like self-testing, HIV self-testing, that people can actually test themselves and know their status. Though the other self-testing technologies for other STIs are not yet available, but we believe that with time all these are going to be available. Therefore, ensuring that people are also able to screen themselves, but apart from just going to medical facilities to be screened, it's also a tool that can be used for prevention of some of these STIs. So it is quite a range of issues. And the adolescent, for example, as I was talking about the program, the young people, those below around 14 years of age, there are already programs in schools that vaccinate, the vaccination programs. These young people can actually be vaccinated. They have adolescent girls and women can also, they are part of these programs for vaccination. They can be vaccinated, for example, against HPV, which causes cervical cancer. So it's a whole range of programs that the minister has put in place to ensure that we address STIs in these populations.
Okay, let's talk about the relationship between public and private sector in regards to STI and the control measures and appropriate treatments, sensitization, etc. Surveys of health-seeking behavior in Uganda have indicated that substantial proportion of people with symptomatic STIs and STDs seek treatment in informal or private sector, or they'll go to traditional healers, they'll go to singers, or they'll go to unqualified practitioners, or they will go to the street vendors. You know, sure. I don't know if you have the chance to walk around downtown Kampala.
Yeah, sure.
There is Zindaro. This one treats this, it treats these following diseases, and you're thinking, where's the verification in these Bizindalo doctors? Yes. And also pharmaceuticals and private practitioners. So how do you intend to merge your campaigns with private sector in terms of promotion and appropriate treatment?
Yes, of course, yes, it is very true that sometimes people, quite often people also go into seek for treatment from informal places. That is very true. And it's not something that can easily change, but the most important thing is to give people information that once you recognize signs and symptoms of this particular nature in your private parts, please go and seek for care in qualified or in appropriate places. But one of the things that the ministry has been doing is to ensure that we educate our healthcare providers. The beauty is that a significant proportion of people that work in healthcare facilities that are government, they also work in private facilities. Therefore, by educating the healthcare providers in the system, public health system, they also somehow cover. But also there are those ones that are not really covered under that kind of arrangement. And therefore the minister provides guidance to them through provision of the guidelines, how STIs are treated. There are treatment guidelines that are provided by the ministry to all healthcare providers, including public facilities, which guide the healthcare providers on how best to manage STIs. But also engaging those other people in the informal sector to be able to guide people appropriately. But of course the challenge is that because of the health benefit of the people in the informal sector using the STI, sometimes they end up not directing people, taking actually advantage of people because of their ignorance. But the efforts are there, and we have been educating people in the informal sector to guide in terms of signs. Once somebody comes with these particular signs and symptoms, please refer them to appropriate places where they can get appropriate medical care. In the pharmacies, yes, the pharmacists, once they have also provided for special packets. Like if somebody came to a pharmacy, all the prepackaged drugs for STIs, like drug shops, there are those prepackaged drugs for different STIs. Therefore, somebody who has those signs, the most important is to be able to recognize signs and symptoms, and therefore they use those prepackaged drugs and they give them, because not everybody is going to be coming to a public facility for treatment. And therefore the most important is to equip them in terms of knowledge and understanding and management of STIs. But for those that are in the informal sector, it is to give them information, and that's what we do, providing information to them to be able to refer to appropriate places rather than treating them for things that they do not understand properly.
Okay, yes. Dr. Jambade, we also want to look at national level engagement in terms of policy, mobilization, even priority setting. Yes. Back in the day, failure to control STIs was not really the sole result of antibiotics resistance or emerging organisms, but the result of lack of political will and interventions from governments in terms of investing in appropriate measures, appropriate controls, or scaling down or even sustaining the different campaigns that have come through over the year, especially for the case of Uganda. So there's been reluctancy to actually follow up on these different programs, the sustainability of it. And I know earlier on you had talked about the funding of it. Funding for STIs went down, and for HIV in particular has gone high, and it continues to be the case right now. So in terms of mobilizing policy and governmental engagement and involvement in the sustainable tools and apertures that you talk about, where do we stand?
Of course, the government, it is, as I said, it is the issue of marginalization of STIs has been kind of a global issue when HIV came on board. But in the recent years, that picture is changing globally, but also in country. There are more efforts now and more resources being committed for management of STIs. And in terms of, for example, at national level, in terms of ensuring that many resources become available to support management of STIs, appropriate management of STIs in terms of capacity building for the healthcare providers, but also in terms of providing drugs and facilities to manage STIs appropriately, but also in terms of providing information to people. And basically, that's why this is part of it, being on these radio programs, TV programs, to ensure that people get information. So the picture is changing. Of course, you cannot realize the results immediately, but we believe with more commitment of more resources and more refocusing of course, not forgetting HIV, because it is also an STI, but also putting some part of that effort to STIs is very key, and that's what is happening within the ministry, that we also need to address the component, the issues of STI. There are quite a number of programs, as I said, the vaccination programs, the information programs, the treatment programs, programs that were supported by our partners, PEPFAR DREAMS program, which also focusing on helping our young people in terms of building their skills, so that because poverty, when people are poor, sometimes they resort to sex as a source of income. So all those programs, the DREAMS program are there, that which are focusing on the younger people, heavily funded by our partners. So we are seeing a change in terms of focus as far as STIs are concerned. Okay.
Dr. Chambade, you've talked about programs and resources. We do have the Parish Development Model. That is a program for government. There's resources that are going down to the parish level, 100 million per parish. So far, some have received 17 million of that. Is there an opportunity for the Ministry of Health to jump onto this program to be able to extend sensitization of STI and STDs?
Yes, it is possible. Actually, what happens is that usually some of the programs ride on other existing government programs. And of course, the Parish Development Model is quite a recent program. As Minister, we have not yet taken on that particular effort to ensure that we ride, but all the previous existing programs, the Minister takes advantage of those existing programs in terms of providing information. And because, of course, we have structures right from the Ministry to the lowest level, we have up the health center tools, we have healthcare providers. And what we do is that we give instructions or guidance to the healthcare providers in our facilities to engage with those that are involved in those programs. And we use those platforms to provide information for STIs, but also for HIV. And those communities exist, those structures exist, but also already have other existing structures, as you said. Our volunteers within the communities do exist, and therefore the issue is about trying to take advantage of these new platforms, new programs, as you said, the Parish Development Model, to ensure that as they engage the communities, our health providers also are part of those processes, and therefore they can educate people, give information to people, which again can spread lower down.
Okay.
Yeah.
Dr. Chambade, now as we're coming to the close of this dialogue, I want to hear from you, what is the way forward? What's the call to action right from the Ministry of Health in regards to one, screening, testing and treatments, but then also the behavior change that you talked about in regards to sex?
Yes. Of course, if you look at for example, at the time when HIV had just come, and you look at the programs that were available, we were running on TVs, on radios, on all different platforms, even in the communities regarding HIV. With time, of course, fatigue comes in. And people almost, you remember, even in most of those, every community activity, let it be burials, whatever, weddings, people would still talk about HIV. And those things still happen, those activities still happen within our communities. And what we need is to people take advantage and to communicate to our people about STIs, but also talk about HIV, because STIs are still there. They have not gone away, but also HIV itself has not gone away. We still have a significant number of new HIV infections happening within the country. Therefore, the call is to call upon everybody, every responsible person in our communities, whoever gets an opportunity at any platform, let it be wedding, let it be church, to use that platform and communicate to people that STIs are there, they still exist, and they can cause death themselves, but also cause very serious complications to our people. Therefore, we call upon all, I would say, gatekeepers in the communities at whatever level, cultural leaders, religious leaders, political leaders, that whenever they have an opportunity to talk to the people, let them also talk about HIV, but at the same time talk about STIs to people.
Okay, and we've had that opportunity for 1 hour to talk to you about STI and STDs, but you too have an opportunity to talk to your friend, your neighbor, your partner, and we don't have to wait for a time when someone is having signs and symptoms. No, let's have this conversation in advance so that someone is aware of this information. That way they can make better sexually related decisions for a healthier country and for a healthier economy. That has been all from us in partnership with the Ministry of Health and UGANET. Thank you so much for watching. Have yourselves a good day.